non-invasive, respectful, mentoring, compassionate. These are the values of Palmdale Regional Medical Center. And now we proudly present Palmdale Regional Radio.
This is Palmdale Regional Radio. I'm Maggie McKay. If you ever feel like you can't bend down to pick up something you've dropped, or you're suffering due to back pain from something like a herniated disc, an endoscopic spine procedure may be the solution. Joining me today is Dr. Tyler Carson, a neurosurgeon at Palmdale Regional Medical Center. Thank you so much for being with us today, Dr. Carson.
Thank you for having me, Maggie.
Let's dig right in. What is endoscopic spine surgery?
Well, endoscopic spine surgery is basically a minimally invasive method for performing a surgery that in past has been performed by an open technique or making a larger incision and dissecting more tissue. It's essentially the most minimally invasive way to access the spine.
Who would be a candidate for minimally invasive spinal surgery?
Yeah, so anybody that has been suffering from leg pain or radiculopathy or sciatica, from disc herniations that are causing compression of their nerves in their low back, would be a great candidate for this. And ideally, this allows us to minimally invasively access one level or even two levels of the spine through a few small incisions in the back.
So are there limitations to the conventional endoscopic spinal surgery as opposed to this method?
Right. So there's a couple of endoscopic methods, and the method that I use is what's called a dual access or dual portal method, where we're basically making two small incisions to place a camera through one and instruments through the other. And that allows us to triangulate to a position in the spine and bypass all of the tissue dissection that we would normally need to do on the way in. Another endoscopic method is what they call uniportal, or a single incision, and both the camera and instruments go through the same incision. And the benefit of that is it's a single incision, but the downside of that is that the instruments always come in to the spine at the same angle. And this doesn't really allow for as much freedom of movement of the instrument as the dual access method.
And when it comes to a minimally invasive approach, how does that improve the surgery outcome?
Minimally invasive approach allows us to cause less damage to the tissue. That means patients would heal up faster from this, have less pain after surgery, and there's less chance of an infection due to less damage to tissue. So a lot of these endoscopic procedures can be done as an outpatient procedure where the patient goes home the same day.
Wow, that's impressive. Is that the same story with the traditional method?
So typically with the traditional method, most of the time the patient will be staying overnight for at least a night in the hospital. And there's variations that people may call minimally invasive spine surgery. A couple of other methods for minimally invasive spine surgery include making a smaller incision and using specific retractors to move muscle out of the way, sometimes a tubular retractor, sometimes retractor blades. These are both considered minimally invasive methods, but endoscopic is truly the most minimally invasive method. We don't have to cut through muscle. We just place the cameras through the muscle and get down to the bottom of the spine where we need to do the surgery.
So I imagine recovery is a lot faster?
It is. The patients who've had this done, in my experience, are up and walking 30 minutes after the surgery and don't really experience anything in the way of postoperative pain.
So they're better than they were before?
Absolutely.
Is there physical therapy or medication involved after they get home?
Patients will usually get started with physical therapy a week or two after the surgery, and it sort of depends on what their symptoms were before the surgery, especially if they're having weakness and need to work on strengthening their lower extremity muscles again after the surgery because they've been dealing with it for so long. Then we'll get them started with physical therapy. And pain-wise, most of the time people get by with just a Tylenol for the first few days after the surgery.
And so take us back maybe 20 years when somebody had the similar kind of procedure, the traditional method. How long would recovery have been then?
The traditional method basically involved making an incision down the middle of your back and disconnecting the muscles from the bones in the spine and moving the muscles out of the way to get down to the spine. And then once you perform the surgery on the spine, suturing the muscle and the skin back together, that takes a good 6 weeks to heal up from that surgery. As opposed to this, we're basically closing the incisions up with a Band-Aid, and that's
amazing.
it.
That's amazing. And Dr. Carson, is age a factor when it comes to who's a candidate for endoscopic spine surgery?
So age is a factor only in the sense of the patient's ability to undergo anesthesia. So most of these procedures we do under general anesthesia, though I have done one with spinal anesthesia where the patient was awake for the surgery. But this is a great option, especially for elderly patients. It's much more minimally invasive, very minimal to no blood loss, and very quick recovery for them.
Are there any side effects?
The side effects or risks with this surgery are similar to risks with open spine surgery, with the exception of much less chance of infection and much less chance of significant bleeding. There's risk to injury to the nerves or injury to the surrounding muscle or bone, but that is very minimal when we're placing just small instruments down there. And the main risk with any surgery really is the patient undergoing anesthesia for that surgery. So we always have to take that into consideration.
Is it still the case that this procedure is only being done 2 places, one of which is Palmdale Regional Medical Center?
In the Southern California area, there's only a few people doing this particular technique with the dual portal, and Palmdale is one of them.
That's great. So what does the future of endoscopic spine surgery look like?
The future of endoscopic spine surgery we foresee as becoming what has happened with endoscopic general surgery cases, which is moving more and more towards robotic-assisted surgery, performing more and more of the larger fusion type surgeries through the endoscope, and augmenting this with virtual reality to allow us to bring in the patient's preoperative imaging and give the surgeon complete visualization of the spine through these 2 small openings.
Doctor, is there anything else you'd like to share?
I would just like to say that this is a great new technique. The successes that I've seen with patients have been really wonderful. And if you've been considering spine surgery but have been told never have spine surgery because you'll never be the same again, this is the technique for you. This causes very, very minimal tissue damage, and you'll heal up from this very quickly.
Thank you so much for being here and sharing your expertise, Dr. Carson. This has been so helpful and educational.
Thank you for having me.
And that concludes another episode of Palmdale Regional Radio with Palmdale Regional Medical Center. Please visit our website at palmdaleregional.com for more information and to get connected with one of our providers. Please remember to subscribe, rate, and review this podcast and all the other Palmdale Regional Medical Center podcasts. For more health tips and updates, follow us on your social channels. Please share your social media and be sure to check out all the other interesting podcasts in our library. Physicians are independent practitioners who are not employees or agents of Palmdale Regional Medical Center. The hospital shall not be liable for actions or treatments provided by physicians. Individual results may vary. There are risks associated with any surgical procedure. Talk with your doctor about these risks to find out if minimally invasive surgery is right for you. I'm your host, Maggie McKay. Be well.